Morning, Michelle. We're going to take a look at some of those numbers that you've had. 2.1 billion Kenyan shillings is the amount that USAID is retrieving from Kenya's health support. We're going to take a look at that and what that really means for Kenya. Also, there you go, 2.1 billion Kenyan shillings. Now, of course, the reason for them to pull out is the issue of graft as well as corruption. There is lack of accountability. Now, they are saying this is a way of protecting the U.S. taxpayers, but Kenyans are the ones who are going to have to feel the pinch on this 2.1 billion withdrawal from the U.S. government. All right, let's see what else we have. We could go on to our next board. This one really breaks down for you in the past years how the U.S. government has really contributed within Kenya's healthcare system from 2011 to 2016. You will notice a majority of this really happened during Obama's administration. 47.9 billion Kenyan shillings in 2011. But let me draw your attention to 2016, where it has the biggest number at 65 billion Kenyan shillings. So it really varies from different years. Take a look at 2013, 26.1 billion. 2015, also another high number, standing at 47.8 billion. So all these different years really shows you how the USAID, or rather USAID, has really funded Kenya's healthcare system. All right. Also, on top of that, I also want you to take a look at this one. The programs that are under this specific pull-out, how they are being affected: nutrition, family planning, maternal health, as well as childcare health. Now, on top of that, it's not just these 7 programs that you're seeing on the super wall that are being affected, such as malaria, tuberculosis, HIV and AIDS, as well as the other health programs. But also there's the issue of salary as well as wages. All staff under the global health security agenda, their salaries and wages might also have to be stopped. On top of that, domestic and international travel, as well as training and conferences. Other key areas that are going to face or are going to suffer from this suspension: salaries, as I have mentioned, training as well as conferences. The ongoing investigations that we are seeing. Earlier this year, Afya House was in a scandal, 5 billion Kenyan shillings that are not being accounted for, as well as 250 million Kenyan shillings. Now, from this 5 billion Kenyan shillings that is not being accounted for, it saw the likes of CS Cleophas Mailu, as well as his PS Nicholas Muragori, really come under the public eye. However, the ministry really insisted, rather, that it's not 5 billion Kenyan shillings, it's 3 billion Kenyan shillings. Now, this 250 million that you're seeing for domestic, for doctors training, rather, Dr. Ogula from the Doctors Union requested, or rather say, that he wanted to see a letter, an audit of this 250 million Kenyan shillings that you're seeing. But only out of this 250 million, he said 184 was released, 184 million to pay 350 interns. Of those 350 interns, not all of them were paid. So that really has a few of the loopholes that we're seeing in Kenya's health sector. Of course, this comes after a few months that Kenya has seen within the health sector really crumbling. This is also not a good time for this to be taking place, but that's where the 2.1 billion Kenyan shillings that is happening. Let me draw your attention at this. This is the HIV support that will not remain affected. 250,000 Kenyan shillings, Kenyans rather, receive ARVs. So that's one critical point that will not be affected from this 2.1 billion Kenyan shillings withdrawal that we're seeing from the U.S. government. Michelle.
Zinzi, very interesting statistics there. But of course, we need to put this into more perspective. So